My name is Courtney Carmichael, and I am a physical therapist. I specialize in pediatric physical therapy. I've been working in the field for about 12 years now. I grew up as an elite alpine ski racer. I competed at an elite level, and I represented the United States on both an international and national level, depending on what kind of race it was. So I competed for the U.S. ski team and the U.S. developmental team in various competitions. I had my career-ending injury when I was 18, and I had had several injuries before that, but I had a traumatic brain injury at 18 years old, and that really sparked my interest in the field of physical therapy. I began working as a rehab aide up at Barton Memorial Hospital and was encouraged to continue in the field of physical therapy. And then my experience as a youth athlete that has been through several surgeries and rehabilitations myself is that I wanted to pursue the field of pediatrics and youth sports and sports medicine rehabilitation for children. I know that as a clinician, we are seeing more injuries that are overuse related at a younger age in children. So it used to be that we would see the ACL tears in females from soccer, for example, at about age 15, 16. We're seeing them at much younger ages now. So I can think of several kids I've seen under the age of 13 that have had ACL tears, which can be a career-ending injury for a lot of kids. In physical therapy, especially in this area, we see a lot of ACL injuries, so that would be a knee injury. Anterior cruciate ligament, we see a lot of meniscus tears. Actually, several overuse injuries pertaining to baseball or softball, lots of throwing arm injuries, shoulders, elbows. 100% of the overuse injuries are all preventable. As a youth athlete myself, a former youth athlete, I experienced a lot of overuse injuries, whether it was something that ended up being surgical or if it was something that could be rehabilitated through exercises and manual therapy. All of those were preventable. There are some things that aren't preventable, like brain injuries and things that you can't see coming, but as far as overuse injuries like in baseball or soccer, usually that's from overtraining a young athlete. One of the biggest ways to potentially be injured as a youth athlete is by specializing too early, and that also causes psychological issues such as mental and psychological stress in addition to the physical stress. But we want to prevent that from happening to our youth athletes. So the physical and mental implications are pretty strong with overtraining. So there are 9 stages for developing the long-term athlete. So from the active start stage, when you start children at a very young age, then there are several fundamental stages as you're building the young athlete. There's the active start, there's the fundamental, you learn to train, then you actually train to train, then you're learning to compete, training to compete, learning to win, winning for a living, and then actually active for life. So the final stage is learning how to phase out of being an athlete and into having an active lifestyle as an adult. So there's 8 stages of youth development, 1 stage of phasing out of the youth development as an active older adult. The actual specifics of when you should start weight training is very dependent on the child's development. So it's something that you should really probably talk to a physician about, because they're going to be the ones that know at the rate of which the child is growing. With girls, obviously, it's with the onset of puberty. But with boys, it's a little bit different. It's their bones growing compared to their tendons and muscles. So you don't want to start them too early because bones tend to grow faster. So if you start weight training too early, you're very much putting them at risk for having a weight training related overuse injury. So realistically, when you talk about sports specialization, which tends to be the biggest problem in overuse injuries, sports specialization is considered stage 5, where you're learning to compete. And for girls, that starts at about age 15 to 17, depending on their rate of development. And for boys, they should really start specializing at about age 16 to 18. So it's significantly later than most of us actually start specializing in a sport. I specialized at, if I remember correctly, age 11, which is probably why I had several overuse injuries. But I think it's important to note that the reason why we don't have children specialize early is so that they can use the other sports as cross-training. And that's what we try to emphasize to parents when we see them in our clinic, or when I see the children, in the school district or elsewhere in the community. We try to educate the parents, caregivers, coaches that early sports specialization is actually not helpful to the child. It can be very detrimental. So we want them to continue cross-training, doing soccer and then basketball and then football, or vice versa, depending on the seasons and how the sports fall, is very important, so that everybody's able to cross-train amongst the different sports, so that you have that fine balance of strength between the different areas. I was injured and had a reconstructive surgery at 16 on my ankle, and I know that my rehabilitation was affected because my tissues took longer to heal. And so as a clinician now, I can think and relate back to that experience as a youth athlete and think, oh yeah, that makes sense, because it took me longer to heal than now that I see an adult with the exact same procedure heal. The healing time is very different. It took me at least 4 to 6 weeks longer. It's important to know that it's going to take longer, and that your child or your athlete is going to be out of the sport for longer, and that's okay. It's important to get the healing done and then go back to the sport when they're completely ready and rehabilitated. As a child's in high school, you're sometimes dealing with college scouts or coaches, and they're asking, and parents, when can my kid get back to playing? And that's what it's all about. But really, the question should be, when can my child or athlete get back to playing at 100%? Because that's what really matters. And you want them to have lifetime health versus injuries as the same injury, or having problems as an adult in their joints because we rush them back too early. Having that treatment time is so important, because their bodies have to rehabilitate and get back to being able to compete at that high level. So it's not just training to train, you're training back to compete again, which is very different. Mm-hmm. So we want to make it as close to a competitive level as we can before we actually throw a child back out onto the field or onto the court, so that we know that they're not going to get re-injured or have any further issues on that side or even the other side.